Every year we hear the same message: get the flu shot. Protect yourself. Don't risk it. Well, one doctor is here to say you're seeing and hearing those warnings for a very good reason. Dr. Serign Marong from Banner University Medicine is here to discuss. Doctor, thanks so much for joining me today.
Yeah, cool. Thanks for having me.
Very important topic, because we're getting into that time of year where people don't heed these warnings. All of a sudden they're left sick and they're going to think, I wish I had listened to the warnings and to the doctors. So let's talk about some tips to stay healthy during flu season and how to prevent it.
Okay. Well, I mean, first of all, the #1 way to prevent it is by getting the flu vaccine, which is what we're talking about today. Yeah. So that's going to be your best defense against it, and your best defense against it every year. In addition, of course, to the flu vaccine, which they change every year based off of research and what's going to be the most common strain that's out there. Other things you can do, of course, are hand hygiene, hand gel, washing all the time, covering your cough, covering your sneeze, those kinds of things.
That hand sanitizer, man, I tell you, it's so important, because you're touching all these surfaces all day long.
Right.
And the flu virus could be on any one of them. And so where can we get the flu shot? I mean, it's pretty much anywhere these days, right?
Pretty much anywhere. Of course, with Banner Health, Banner University, a lot of our urgent cares, you can go in and get them. And of course, your PCP office as well, too, is a place where you can get your flu shot.
And speaking of who's at risk of getting the flu, I mean, anybody can contract it, but who specifically would you say is even more at risk?
Right. Well, first of all, it's recommended ages 6 months and up, so that's the recommended one. However, people who are more at risk are going to be kids who are less than 5 years old, adults greater than 65. And then for adults, or people in between those ages, people with chronic diseases, chronic lung disease, asthma, COPD, heart diseases, other things that affect their immune system. Those are the people who are most at risk when they get the flu.
6 months. I didn't realize you could get it that young.
Right.
And like you say, getting the flu when you have other conditions could actually complicate them.
Absolutely.
And so we're talking about PCPs also. You mentioned PCPs, primary care physicians is what it stands for. So why is it important to establish one? A lot of people, you ask them who their doctor is, they say, I don't actually have one right now. How important is it to get one? Yeah,
it's funny you say, I see that all the time. People, they don't have one, or they're going to a specialist and they kind of think their specialist is their PCP, and that's not the case. Yeah. So what I get all the time is someone needs to go somewhere else, so they have to come to me for a referral. But the way I approach it is that primary care physician is about prevention, so we want to start treatment early or detect things early before it's too far and you have to go and see a specialist. Yeah. So having that doctor, and especially a family doctor who knows the whole family, we see kids, we love seeing whole families together, from day 1 old all the way up. So having that established and then being able to prevent a lot of these things that come along later in life. And plus, when the physician knows you well for a long time, they can better take care of you. Right,
that physician's your best friend. I mean, they have the complete picture of what your health is, and like you're saying, they know your family history. So if there's history of heart disease, for example, they can better prepare you and give you tips to prevent that. What are some other common reasons to see a PCP?
To see a PCP, and it's specifically a family doctor, we get lots of well-child checks, so kids who need their immunizations. But in that wide range, so somebody just wants their cholesterol checked, or you need a procedure done. I do a lot of sports physicals, but we also just do even the more complicated things. We do diabetes management, hypertension, kidney disease, So even some of those things that are diagnosed that some people like to go to a specialist for, we can also take care of in our office. So.
Well, I'm sure as a doctor you can talk about the importance of getting that yearly physical. I mean, the fact is, if you go to that physical, you could catch something, the doctor could see something that you never would have seen in a million years if you hadn't gone and done that physical. So tell us about your practice specifically.
Well, my practice, it's a new practice. It's Banner North. So it's a clinic we're just getting going. There's just a couple of us in there. We just got a new doc the other day, Dr. Dranavali, and we're both seeing new patients. And so, just a wide range of family medicine. Neither of us do OB care anymore, but that's also part of what some family docs do as well too. But in my specific practice, besides just prevention and primary care, I have a big interest in sports medicine with my background, even addiction medicine as well too. So there's lots of things, and different docs are going to have sort of their own niche of their own interest within general family practice as well.
Well, it's a good reminder that, like I said earlier, a doctor is your best friend. They have your best interest in mind, and your health is in their hands, and they're going to take care of it very well. And so circling back for just a second to that flu shot, is there such a thing as getting the flu shot too early? or too late?
Not too early necessarily. I mean, you should be getting coverage through the whole season, but you want us to get it at the beginning of the season, which, you know, now is a good time to do it, or at least by the end of October. Once you do receive it, it's going to take a couple of weeks for it to be fully effective, but now's the time to get on it. Usually when people say, I got the flu shot and I still got the flu, that's not the case. They didn't actually get the flu. They might have been sick with something else, or potentially they were exposed to the virus before their flu shot actually was effective.
Well, I know I will certainly be in line to get that flu shot. I mean, there's really no reason not to do it. You might as well take care of it now and not regret it when you get when and if you get sick.
So it's all about prevention.
Exactly. Doctor, thanks so much for your time today. Very important stuff.
Cool. Thanks for having me.
Appreciate it. Now, for an appointment with Dr. Marong, call 520-694-0111, and you can learn more by visiting bannerhealth.com.